Hello, doctors and providers at Pediatric Pathways. My name is Dr. Isaac Muberry, and I just wanted to send you a quick little overview as it seems as though your practice aligns with what our ideals are for our patients with a holistic multi-team approach to healthcare. And I am ICPA certified with the Webster technique, as well as I've taken and got certified with the Focus certification series, which is dealing with sensory processing disorders and the evaluation and care of those children, as well as adults. But I just wanted to give you a little bit of an overview on how we approach health and healing here in our office. I'll do a complimentary consultation over the phone with parents or even providers when they're considering potentially referring people or coming in for an evaluation. I'll chat with the parents over the phone initially as well to get a better idea, so they're not having to divulge all the, I'll just say, negative things they're noticing with their kids, whether it's learning or behavior or whatever it might be, so that way the kid doesn't develop a complex about having so many problems. When they come into the office, we'll do a sensory exam with checking for ingrained movement reflexes that they should be outgrowing, but oftentimes these sensory kids have these reflexes that are ingrained. We'll also check the ocular motor system as well as postural system, and we'll also do different fine and gross motor checks with them as well. And then we move into more of the technology section of our exam, and I have a couple things here to show you. This is one of the tests that we do. All these tests that I'm going to reference here are evaluating the autonomic nervous system, how well balanced it is. Balance is critical in the autonomic nervous system. A lot of kids tend to be skewed on that sympathetic side, which is that fight, flight, or freeze, which a lot of these kids are dealing with anxieties and problems processing what their environment is giving them to have a normal output, and they don't have that normal output, and we see that this nervous system is imbalanced. So we do initial scans and follow-up scans. White would be within normal limits, green's mild, blue's mild, red severe, black is off the scale. This is actually one of the kids in the testimonials that you'll see below. His name was Mac, but he wasn't able to poop. He was a nonverbal autistic child, but as you'll see in the testimonial, what some of his outcomes were. This is a thermal scan here, so we want to see it be white as well. When there's an imbalance here where you can see most of the bars are on one side, that tells us there's a problem up here at the top of the neck. We'll also do a heart rate variability test with kids that can sit still for a long enough period of time with that. What we found is that there's a tremendous amount of trauma that occurs during childbirth and labor process, and there's a tremendous number of proprioceptors here in the neck at the base of the skull and the brainstem. And when there's trauma at birth, it can be mild or moderate, and it's not even really necessarily recognized during the initial phases of that child's life, but that can affect the proprioceptive system, which throws everything else off during development, and it can affect behaviors, learning challenges, behavioral challenges can result. Some of the more mild symptoms that may be present earlier in life are colic, reflux, recurrent ear infections. There can be a number of things, kids that don't actually crawl and they just can go right to walking. That can be a red flag that there's sensory processing issues at play. The same thing with kids that learn to read too early. That can point towards sensory processing challenges. But please, if you do have any questions, I just wanted to give you a brief overview. I'd love to connect with you individually or to chat with you over the phone. But please look at the little testimonials below, and I hope this has been helpful, and I would love the opportunity to be able to take care of the kids coming into your practice and their families to help with these issues and others. Thank you.